death sentence served chained to toilets, unable to walk, without food, as my heart and nervous system tried to escape, night after night. The surgeon ordered an MRI that showed some pelvic fluid and what looked like the return of a tiny endometrioma. She said that additional surgery wasn't an option, and I really only survived the following months by researching and questioning every recommendation from every doctor and trying to learn to trust myself. Folks with endo are often thought of as problem patients for questioning doctors, which only further adds to the complex medical trauma we experience. A year post-op, another MRI showed that the endometrioma had doubled in size. I relied on internet groups to research experts and waited months for surgical consultations out of state. There's OBGYNs who may perform ablation or a fellowship to excise endo, and then there's the real experts. With all my being, I knew there was more endo that would require one of the very few surgeons with years of experience identifying and removing advanced lesions throughout the body, mainly by themselves or with a team. I suspected I had lesions involving my intestines and my rectum and my diaphragm, but was told it was unlikely by the surgeons, whose fees range from $12,000 to $20,000 US, and it was the height of the COVID pandemic. My dad wanted to help me leave the state for surgery, but he died suddenly before he could. I spent hours every week, every day, fighting insurance and got nowhere. Access to wealth should not determine access to care, but with endometriosis, wealth can be the determinant of health. A new doctor who has endo encouraged surgery with an expert as soon as possible and helped me access pain management with suppositories and low-dose naltrexone. Pain with endometriosis should be believed and managed and provided accommodations for, but pain is often dismissed. AbbVie, the company that sells Orilissa and Lupron, spends millions of dollars to lobby decision makers and fund providers and the American College of Obstetricians and Gynecologists who set treatment guidelines. I was desperate to eat, walk, sleep, breathe, or stay conscious when I scheduled a consultation with a surgeon across the country. His skills and experience with removing deep infiltrating endometriosis were exceptional. He was realistic about recovery, the damage advanced endo inflicts, and he listened to me. The surgeon helped me fight insurance with access to a free lawyer and an extensive letter on the medical necessity to have surgery out of state, especially for stage 4 endo, but insurance still denied me. I finally gave up on my insurance. Thanks to COVID special enrollment, I was able to switch to a grossly expensive insurance plan with national health coverage. Crowdfunding from friends and their friends, my partner, his sister, and training hard at pelvic and mental therapy made another big operation possible. The hospital approved my application for financial aid. Every hospital in the US has a different policy. And just like that, our 2-week excision surgery trip began with an illuminating pre-op appointment. I got COVID tested, and then the next day I walked down the block to surgery, thousands of miles away from home. I woke up after 6 hours, and nurses helped me advocate to stay the night and count the new surgical scars. There were 7, 5 new surgical sites across my torso and 2 sites with strings coming out, suspending my ovaries through the abdomen. The surgeon visited my hospital room, gave me the hug I really needed, and used the whiteboard to tell me the story behind each scar.